Hi everyone, today I am giving you information on the topic slit lamp instrumentation. This one is the part 2. So let's see what are the points to remember while using the slit lamp. First one is the patient adjustment, next one is the instrument adjustment. Patient adjustment should be proper as well as the instrument adjustment should be proper while using the slit lamp so that we can examine the patient very carefully. Patient adjustment. Patient should be positioned comfortably in front of the slit lamp, chin resting on the chin rest, forehead opposite to the headrest, can hold the knobs for support. Okay, so in this way the patient have to sit. The chin rest is present on the chin rest, forehead touch to the headrest, as well as these are the knobs present here which the patient can hold for the support. Okay, this was the patient adjustment. Next one is instrument adjustment. The height of the table housing in the slit lamp should be adjusted according to the patient height. The microscope and the illumination system should be aligned with the patient eye to be examined. Fixation targets should be placed at a required position. Okay, so let's see once in this. The height of the patient should be adjusted according to the examiner. Okay, so the chair should be there which needs to do the up and down according to the same position of the patient so that the examiner can position the patient or examine the patient very carefully. Next one is the microscope and illumination system should be aligned with the patient eye to be examined. Okay, if he is examining the right eye, so this may be in the position with the right eye, and the fixation target may be given to the patient if we are examining the patient. Any of the target is given to the patient for the comfortable checking. Next one is other condition. Examination should be carried out in a semi-dark room so that examiner eyes are partially dark, adapted to ensure sensitivity to low intensity of the light. So this examination may be done in the semi-dark room. Okay, there should be no very much illumination. There should be minimum exposure of the light to the retina because we know that the retina is very sensitive to light. So there should be minimum exposure of the retina to the light because it harms the retina. Low magnification should be used first and then use the high magnification. Okay, we can use the low magnification first or we can use the low intensity light first and then use the high intensity light, or the high magnification is done. Observable parts. Which parts we can observe? Eyelids and the eyelashes. Tear film. Tear film is present on the cornea. Next one is the conjunctiva. We can observe the conjunctiva, both all the conjunctiva, palpebral conjunctiva, bulbar conjunctiva. Okay, next one is the limbus part. The limbus is the junction between the cornea as well as the sclera. Next one is the aqueous humor. We can examine the aqueous humor. Anterior chamber, the area between the cornea as well as the iris. Next one is the iris as well as the pupil. Iris is the colored part of the eye and pupil is the darkish black inside the eye, which is a hole. Next one is the crystalline lens. We can also examine the lens. Next one is the anterior vitreous. Outer part of the vitreous we can examine, and we can also use the 90 diopter lens for examining the retina. These are the observable parts. Thank you. This was the end. Thanks for your patience listening.